Hello, good afternoon, Professor. My name is Dimple, and I will explain the topic on capstone and the hospital-acquired infection. The This is the introduction. Hospital-acquired infection is a infection which we acquire during the time of the hospital stay, and the most of the hospital staff is affected by the hospital acquired infections or infectious illness obtained on the grounds of a healthcare facility are referred to as healthcare associated infections or healthcare acquired infections. The frontline nursing personnel give care to the patient who have the opportunity to avoid such illness as much as feasible. The healthcare personnel is affected by hospital acquired infection in terms of contracting the disease and transmitting to their families, co-workers, and victims. Significant expenses, sickness, and the inability to regulate the number of guests on the grounds have a negative impact on the ability to control a contagious illness. The next is evaluating the outcome. The main outcome that will be achieved will be analysis of the hospital acquired infection and the role that has been played by the nursing professionals in controlling the disease. The analysis and the assessment of the data and the facts will be discussed, and thus the integration of the main ideas have been done. Hand hygiene and environmental cleanliness are the two most essential elements in preventing hospital acquired infections prior to contacting a patient, before an antiseptic treatment, after patient setting. There are five instances in which WHO recommended hand hygiene should indeed be practiced. Consequently, surface and the equipment cleaning should also be required to prevent hospital acquired infection. The reason behind these statements will be assessed, and thus the main outcome will be achieved. The next is barriers and sustainability. The main barriers are not following the rules by the hospital staff, not following the rules by patients and patients' parties, fail to mitigate the safety environment procedures due to heavy loads on any epidemic, sustainability plan, surveillance, maintaining proper infrastructure, proper data management and work according to the capacity of the healthcare center. The next is outline of plan. The issues will be identified and thus the issues will be eradicated. The analysis of the data and the facts have been identified. Adoption of sustainable education measures may be crucial, and thus the demonstration of the main data and the facts will be described. Adoption of these measures will help the finish the task in a systematic manner. Therefore, the main aims will be fulfilled. The plan will be successful to obtain the final outcomes, and therefore the final result will be achieved, will be precise and aligned with the main requirement. The next is conclusion. Based on the above studies, it can be concluded that HAI are very common while treating the patients in any hospital or any healthcare premises. Possible solutions and their outcomes have been discussed, like hand washing and before and after touching the patient before any procedure. It is very necessary. Outcomes have been discussed along with discussing the ways HAIs affect the healthcare staff and the leadership and patients. Therefore, acts that can be followed to prevent the HAIs in the healthcare system have been discussed by monitoring their barriers as well. The next is thank you.